Times are changing, and now we see hygienists across the nation embracing this skill set of administering local anesthesia. On this episode of RDH Coast to Coast, Tina and Kim discuss the importance of this skill set and how it can benefit the practice and your patient. So friends, grab your headphones, take a deep breath, and let's take a look at the wonders of local anesthesia.
Hello, Tina. How are you today?
Hey, Kim. I'm doing really well. Thanks for asking. How about for you?
I'm doing great as well. I wanted to kind of start us off on this episode to really dive in a little bit more with local anesthesia.
My jam.
I think, yes, absolutely your jam. And I want to kind of give you this time to really talk about something that you are so passionate about. I'd also like to first start by asking you how you got so involved in local anesthesia. What was kind of your trajectory that brought you there?
Right. So the joy and passion of anesthesia, I would say, is probably kind of an interesting one. One, I've always enjoyed anatomy and head and neck anatomy, and I've always geeked out over it. I mean, I even have my Mr. Skull was just sitting next to my computer right here. There's that. And when it was time to start teaching hygiene students this skill set of local anesthesia, it was one of those moments where I was like, awesome, I get to really put in forefront my love of head neck anatomy and then instill confidence at the same time. And so as I was going through it and teaching them, I developed this wow, this is so cool, awesome kind of approach to it. I mean, I always enjoyed anesthesia as a clinician providing it for my patients, but it wasn't until I started teaching hygiene students that I really started diving into the joy of it. So that's kind of where that kind of sparked. And then I just kind of started becoming the go-to person in my area. Like when the students would graduate, they'd talk with people that, in their office. And then more and more people just started asking me questions about it. So yeah, that's how the joy of it came about for sure.
And I think I want to say now too, you're not the go-to person in your area, but you're kind of the go-to person for local anesthesia,
I would
right?
like to say that. Sure, I'm gonna boop boop to my
absolutely tune it on out.
Yeah. It's one of those things of, for any time that there's something that you really are into, how much small steps every day can make a huge impact. You can't get to the end of the road if you don't start. And now with being here in Oregon, being the board approved anesthesia certification provider for the state of Oregon, and now I have that designation for the state of Georgia as well. That has been a huge, awesome kind of a thing to happen. And my goal is to be able to go do it nationwide. That's the ultimate goal.
Absolutely. Yeah. Now, is Georgia the last state to get on board with local anesthesia, or are there any more? Is Texas?
Well, yeah. So Texas is the, as of right now, is the most recent one to make it a legal aspect, but their board of dentistry is still working on the rules and regulations of what can a hygienist, what's the training supposed to look like, and all of that. They'll be able to only do infiltration style anesthesia. As far as I understand, Delaware is still waiting to make that happen. I think they're going to be the last man standing on that regards. I'm hopeful. I haven't talked with anybody in Delaware. So anybody on here that's from Delaware, fill me in, but I haven't talked with anybody from Delaware to find out if that is going through the whole entire process of it. Yeah.
Now, take a moment, and for our listeners that don't have their local anesthesia certification, take a moment and kind of describe what they could be missing out on, or why they should maybe look into getting or taking that certification course.
Right. It is one of those things that I think for me as a hygienist, I've kind of always taken for granted that I get to do this because it's been legal in Oregon since 1975. So 48 years. Hygienist in the state of Oregon. Yeah.
That it's been for so long, yet some states it's not existent.
It's not existent. So for 48 years in the state of Oregon, hygienists have been able to administer local anesthesia, even if their doctor is, still out to lunch or gone for the day for a CE course, we can still see our perio patients and anesthetize them and be totally great. Whereas other states, it hasn't been that way. So for hygienists who maybe went to school 20 years ago and they're like, oh, I've been able to get by this far without having to do anesthesia. I would say, it's kind of one of those things of you don't understand what a filet mignon tastes like unless you've had one. So like if you've been living off of cheeseburgers all your life, you're like, oh yeah, I have beef, no problem. And for my vegetarian friends out there, I'm sorry, this might be a horrible analogy for you, but it's like, you're like, I'm totally fine. But then once you have that filet mignon, you're like, oh, I get it. Okay, there is a difference. And when you can actually administer your own anesthetic and have profound anesthesia, it's amazing how much your patients actually relax in the chair and you're able to truly get to the base of the pocket to remove those toxins, remove that deposit off of the tooth surface, so that way you can help your patient get to health. And I would say, like, yeah, if there's not a lot of inflammation, if there's not a lot of deposit, you're probably fine with this subgingival application. But to get true deposit removal and have your patient be comfortable, injectable anesthesia is where it's at.
Yes. Yeah. And now, do you find any more? I mean, when I graduated almost 15 years ago, I went to work for a doctor, and I was told you can give anesthesia, but you can't give any blocks.
Right.
I think there's still a state too where hygienists can't give blocks, but
right.
they can.
Yeah. And so Texas, Texas, that's where it'll be. And I think it's New Jersey
or New York.
New York. Yes. One of the new states. Yes. Yeah. That is only infiltration style anesthesia for sure. I say it's better than nothing.
I was wondering your take on that.
It's better than nothing. It makes me a little sad because when you do only infiltration style anesthesia, you actually end up having to give more injections and more anesthetic, which really can be more of a concern if the thought process for not doing block anesthesia is for patient safety. It's actually one injection to get a whole area numb can be a lot safer than doing multiple injections.
Yes,
and actually, and your patients are appreciated too.
Right. I was going to say, I remember when I was learning local anesthesia in school, an instructor said, do not treat your patient as a pincushion.
Yeah.
And that kind of stuck with me because I just think of myself and getting all those injections. It's not fun at all. So why not learn the proper way, make it more comfortable for your patient, and let that anesthesia do what it's supposed to do.
And Kim, I think a lot of the reasons why the concern comes up in the dental community about, block versus infiltration, those types of things, that it's, for lack of a better, of a generalization, is that it's generally the dentist profession that has those concerns for hygienists, which, I can understand why they would have it. And the reason why I say I can understand why they have it is when I have looked and talked with dentists who have undergone their local anesthesia training, that oftentimes it was, okay, here's the book, read the chapter, now go do it. Mm-hmm. Right. And so they're like, if that is the training that we as dentists, as doctors get, then what are the hygienists going to be getting? And I will tell you that dental hygienists probably have some of the highest standards of local anesthesia training than I've ever seen. And the amount of time that is put into safety and efficacy for this process is pretty astounding. And it's not until I've had doctors that have been a part of the educational programs that are like, oh, wow, you guys get a lot of training on this, like way more than we ever did. So I can understand why a dentist would be concerned if they're thinking what the education that they had and having somebody doing that,
Yes, absolutely.
Yeah.
It's a rigorous, side-by-side training that we go through with somebody, guiding you the whole way as to exactly what you're doing and practicing and practicing and practicing.
Yeah, it is. And Kim, and you and I both work with students, and when they first pick up a syringe for the first time, it's scary, right? It's like, I always say it's like a seismograph, right? It's like, and so, for even a hygiene student who is deep diving into their education, they've got the educational mindset going as being a learner, it's overwhelming and scary for them. For somebody who's been out for a little while, the thought of it being overwhelming and scary is big too. That is a very, very normal thing. And it's amazing when you decide that you want to make that step on anything that you want to learn, whether it's anesthesia or you're like, oh, I want to learn how to ride a motorcycle or learn how to downhill ski. Like there is that newness and that nervousness that comes with learning anything new.
Yes.
Yeah.
I have 2 more questions.
Okay.
Well, one for our listeners that have their certification, but
Yeah.
they're struggling with their injections. Share your information so that they can find your program that you have,
thank you,
because
Kim.
I send my students, it's so great. So I want to make sure that our listeners are aware as to what you offer also.
Oh, Kim, thank you so much. And I didn't expect that. So thank you. I have a lot of online on-demand courses, like, that are anesthesia refreshers. I do coaching. Like I did anesthesia coaching with somebody just last night about getting confidence and just understanding some refreshing and updates. So you can always just go to my website, teachertinardh.com, and you can see a listing of all the different resources that I have that you can do as CE courses or coaching or hands-on refresher courses. And of course, there's always the social media stuff, right? Like,
yes.
you and I both put stuff out there, just hints and tips for the clinician and for students throughout the day. Yeah. Thank you.
Awesome. And my last question, and I don't know if we talked about this in another episode, but what is your favorite injection?
Oh, my favorite injection. Gosh, that's so hard. But I will say that my favorite injection to teach is the AMSA injection, because it's a palatal injection and people are like, oh my gosh, a palatal. But yes, it's a palatal injection, but I think I love teaching it because it is such a cool one to see happening, because it's not very often we get to see our anesthesia happen.
Right.
But with that AMSA, the anterior middle superior alveolar, for those of you
yes.
who are AMSA, scratch my head. It's actually really, really cool to see it. So yeah, go look out the social medias and go, AMSA, what's that, Tina?
Yes. What's your least favorite? Mine's the PSA. But...
I don't mind the PSA. I would say that my least favorite is doing any type of supraperiosteal or infiltration, depending upon where you learned it, the terminology, right over 8 and 9, because it burns. Right. There's like, we work really hard, and, there's ways to make it so it's better for our patient. But, I would say the most uncomfortable one for our patients. And, then you have tricks that you have to do for stabilization, which, once you know how to do it, it's pretty easy. But yeah, but I would say anytime I have to give those to my patients, I'm like, I just apologize in advance.
Yeah. Oh, I get it. I get it.
Hardcore. Yeah.
Oh, well, this has been great. And thank you so much for sharing all of your insight, because I truly do think that you are an expert on this subject. So I'm so glad we got to take this episode and really dive in a little bit more.
Thank you, Kim. I appreciate it. And like, fingers crossed, right? Delaware gets to be on board, and then we'll have nationwide syringe slinging hygienists, right?
Oh, I love it. Fingers crossed.
Fingers crossed.
All right. Okay. Till next time. Thanks.
Bye. Thank you to our sponsor, Dental Post, the nation's largest dental job board. Be sure to check them out for different types of employment resources. Also, don't forget to like and subscribe to this podcast, and make sure you follow Tina and Kim on all the different social medias to learn other tips and tricks related to dentistry. Until next time, have a great day.